pulling out all the stops to curb the spread of the coronavirus, setting the wheels in motion to ramp up the number of tests. The Eastern Cape samples will now come here for testing at the state-of-the-art laboratory.
Okay, so we have capacity probably to do over 1,000 a day. Other bigger labs probably have even more capacity, but so we are ready. So when a specimen gets collected, it's usually a nasopharyngeal swab and an oropharyngeal swab. So that will be collected out in the community at the clinics, the community health centers, etc. Then we have a network of couriers that will be collecting specimens from all over and bringing it to the lab. Once the specimen gets to the lab, our medical technologists then take over. They process the specimen under normal, safe laboratory conditions. And then the specimens get loaded onto these very high throughput instruments, which are fully automated. Depending on the instrument, it can take a couple of hours to get a result once we've loaded it onto the instrument. So basically, if we get a specimen in the morning, you get the result the same day.
The medical personnel at the lab is also fully protected.
They do have those machines. Actually, the latest technology, it's quite amazing. What I've seen there inside, those machines are there, and then they can explain to you much better. But those are machines that we need for such kind of a work that we are going to be embarking on. So we do have this in the province, we do have here in Nelson Mandela, that will be able to cover the entire province for now.
The 5 mobile units will be manned by doctors and nurses to do screening and testing. The units will be deployed in areas where positive cases have already been reported.
Areas that are going to be prioritized for these vehicles are those areas that already have people who have tested positive, because we would love to test their families and to test their contacts and any other people in that area whom, as we are going to be doing screening, we might find out they also have symptoms. And we are going to start in those far-flung areas with the mobiles. For instance, Sarah Bartman districts, which is far from the laboratory, it is going to get a vehicle. Nelson Mandela Metro is going to get a vehicle because of the number of positives that are in the district, because we would love to cover these contacts of those people immediately. Another one is going to go to Amatole, because we know that Amatole is also far away from a laboratory.
The screening and testing will start on Monday. Lerato Fekisi, SABC News, Port Elizabeth.